Okay, picture this. You're in your NHS interview. It's going great, and then they hit you with it. That question. The one that makes even the most seasoned doctor's mind just stop. And if you're an international medical graduate, you know this one can feel especially tricky. Well, don't sweat it, because we're going to crack it wide open. The panel leans in. You can feel their eyes on you, and they ask, "So, Kellis, how do you practice as a safe doctor?" That silence feels like an eternity, right? What on earth do you say? More importantly, what are they actually asking here? Yeah, if your mind just went totally blank, you're definitely not alone. Look, this question isn't a trick, and there's no single magic answer. It's really about showing them your mindset. And in the next few minutes, I promise, you're going to have a rock-solid framework to build your own standout answer.
All right, so let's get right into it. We're talking about the 3 pillars of safety. This is a super simple framework for a really standout answer. And let me be clear, this isn't about memorizing a script. Nope. This is a mental model so you can build your own authentic answer right there in the moment.
So, what are these pillars? Super easy to remember. It's all about 3 simple actions. Look backward, look forward, and look inward. Let's break down what each of these really means for your answer. First up, Pillar 1, look backward. This is all about reflective practice. See, a safe doctor doesn't just finish a case and forget about it. No way. They're constantly looking back, reviewing what they've done. Are you learning from your mistakes? Are you checking your work against the right standards? Have you been part of audits? Talking about this stuff shows you're serious about getting better and better. Okay, on to Pillar 2, look forward. Because safety isn't just about looking in the rearview mirror, right? You got to be looking at the road ahead. This is all about staying current. It means you're on top of the latest guidelines, you're reading up on new research, and you're actually using the best evidence out there in your day-to-day work. This tells the panel that you're proactive, not just reactive. And that brings us to our third and, honestly, maybe the most crucial pillar, look inward. This is all about self-awareness. A truly safe doctor knows their limits. They have the humility and the confidence to put their hand up and ask for help when they're out of their depth. And it doesn't matter if you're a junior doctor or a top consultant. It also means you're actively looking for feedback, from colleagues, from patients, to find those blind spots we all have. Okay, so if you cover those 3 pillars, you're going to give a really, really good answer. But let's be honest, we're not aiming for good, are we? We're aiming for unforgettable. There's this one counterintuitive truth, this one little thing that almost every other candidate forgets to mention.
So here's the game changer. A common, pretty good answer, it focuses on all the clinical stuff. Audits, guidelines, asking for help. All important. But a standout answer, it includes all of that, plus one more critical piece, your awareness of your own personal well-being.
Think about it. A safe doctor understands that you just can't pour from an empty cup. When you mention that you actively manage your own well-being, that you know the signs of burnout, that you're aware of your own mental health, that shows an incredible level of maturity. It proves you get the fundamental truth. A healthy doctor is a safe doctor.
All right, so you've got the 3-pillar framework. You've got the secret ingredient of well-being. You're so close. But there's one last thing, one final, absolutely vital ingredient that will pull all of this together and make your answer truly powerful.
And here it is, the most important thing to remember. Don't just tell them you're a safe doctor, show them. You see, a good answer just lists off a bunch of attributes, but a great answer proves those attributes with a real personal example. A story is what they'll remember long after you've left the room, not a list of buzzwords. Okay, let's put it all together into a simple action plan. Step 1, weave the 3 pillars, looking backward, forward, and inward into your answer. Step 2, pick one strong personal story that really brings one of those pillars to life. Maybe it was an audit you were involved in or a specific time you knew you had to ask for help. And step 3, practice telling that story. Get it down so it's clear, concise, and impactful. Because that story, that's what's going to make you memorable. So hey, let's get some practice in right now. I want you to think, what's one example from your experience that shows safe practice? Drop it in the comments below. It'll help you prepare and help everyone else learn too. And of course, if this helped you out, a quick like and subscribe would be amazing. We've got plenty more to help you nail that interview. See you in the next one.